Hello everyone. Let's answer some NCLEX practice questions on heart failure. This is question 1. A nurse is caring for 4 clients with heart failure. Which client should the nurse assess first? Answer choice A client with 2 plus bilateral ankle edema and a weight gain of 2 pounds over the past week. B, a client with an oxygen saturation of 88% on room air, crackles, and pink frothy sputum. C, a client requesting pain medication for chronic knee pain. D, a client who reports fatigue after walking to the bathroom. Which one will you select? The correct answer is B, the client with an oxygen saturation of 88%, crackles, and pink frothy sputum. Here is the reason why. This client is experiencing acute pulmonary edema, a life-threatening complication of left-sided heart failure. Priority findings are pink frothy sputum, crackles, and oxygen saturation of 88%. This client should be assessed first because the findings indicate an airway and breathing emergency, which is impaired gas exchange, and it requires immediate intervention. Look at the patient in answer choice B. Without immediate intervention, this client is at risk for severe hypoxia, respiratory failure, or cardiac arrest. Answer choice A is not correct. The findings indicate worsening fluid retention, but the client is not experiencing an immediate respiratory compromise. Answer choice C is not correct because chronic pain is not life-threatening and it doesn't take priority over respiratory problem. Fatigue in answer choice D is also not correct because it is expected in heart failure. It is a sign of decreased cardiac output. This is the next question. A client with chronic heart failure suddenly becomes restless and anxious. What is the nurse's priority assessment? Answer choice A, pain level. B, oxygen saturation. C, blood glucose. D, bowel sounds. What do you think about this one? Which one will you select? The correct answer is B, oxygen saturation. This is the rationale. Restlessness and anxiety are usually early signs of hypoxemia. The nurse should immediately assess oxygenation to find out if the client is developing impaired gas exchange. Pain assessment should be done when pain is suspected. However, the client in this question is showing symptoms that are more consistent with hypoxemia than pain. Hypoglycemia may cause restlessness and confusion. Heart failure places this client at much higher risk for hypoxemia. There is nothing in the question that suggests diabetes or insulin administration. In answer choice D, bowel assessment has nothing to do with the client's acute symptoms. Oxygenation is the highest priority. This is the next question. A client with heart failure is receiving IV furosemide. Which assessment finding indicates the medication is effective? Answer choice A, heart rate decreases from 110 to 90 beats per minute. B, urine output increases to 60 milliliters per hour. C, blood glucose decreases to 80. D, potassium level increases. Which one will you select? The correct answer is B, urine output increases to 60 milliliters per hour. This is the rationale. Furosemide is a loop diuretic. Increased urine output indicates effective diuresis and reduction of excess fluid volume. Lasix is used in heart failure for this purpose. Answer choice A is not correct because furosemide does not lower patient heart rate. A lower heart rate may happen as the client's condition improves, but that does not directly indicate furosemide is effective. Answer choice C is not correct. Lasix does not lower blood glucose levels. However, it is very important to mention that in some clients, loop diuretics may actually contribute to hyperglycemia. Lasix is a potassium wasting diuretic. Potassium will not increase with Lasix. It will go down. So answer choice D is not correct. This is the next question. Which laboratory value requires immediate follow-up in a client receiving furosemide for heart failure? Answer choice A, sodium level of 138. B, potassium level of 2.9. C, creatinine level of 1.0. D, BNP of 120. What do you think about this one? Which one will you select? The correct answer is B, potassium level of 2.9. This is the rationale. Furosemide is considered the most powerful diuretic, and potassium can be lost in the urine after the administration of this medication. So, the risk of hypokalemia is very high. Hypokalemia significantly increases the risk for cardiac arrhythmias, especially in clients with heart failure because they already have a cardiac problem. Answer choice A is not correct. Sodium of 138 is within normal limit. Creatinine level of 1.0 is within normal limit, and which means renal function is normal. BNP level in answer choice D is mildly elevated, and it does not present an immediate emergency. The patient is already receiving treatment for heart failure. The potassium level is the one that presents a much greater immediate risk. Let's take a look at the next question. Which assessment finding is most consistent with right-sided heart failure? Answer choice A, pulmonary crackles. B, flat neck vein. C, jugular vein distension. D, pink frothy sputum. What do you think about this one? Correct answer is C, jugular vein distension. This is the reason why. In right-sided heart failure, blood backs up into the systemic venous circulation, which means common findings will include jugular vein distension, peripheral edema, organ enlargement, ascites, and weight gain. JVD is a specific sign of systemic venous congestion. Crackles are more likely with left-sided heart failure because fluid backs up into the lungs. Pink frothy sputum is a classic sign of acute pulmonary edema, and that results from left-sided heart failure. Flat neck veins in answer choice B is also not correct. This is the next question. Which statement by a client with heart failure indicates correct understanding of discharge teaching? Answer choice A, I'll weigh myself once a week. B, I'll call my provider if I gain more than 2 pounds overnight. C, I'll stop taking my diuretic if I feel better. D, I'll drink extra fluid to prevent dehydration. Which one will you select? The correct answer is B, I'll call my provider if I gain more than 2 pounds overnight. This is the reason why. Rapid weight gain is usually the earliest indicator of worsening heart failure and fluid retention. Daily weight will show whether the patient is improving or not. Giving instructions to the patient to quickly report this is the right thing to do, and that will allow for early treatment adjustment and may actually prevent hospitalization. Checking their weight on a weekly basis, that's not frequent enough to detect fluid retention on time. Heart failure is a chronic condition. If patients stop taking prescribed medications, they may develop more fluid overload, worsening symptoms, and they may end up being admitted into the hospital. Answer choice D is not correct because patients with heart failure should follow their prescribed fluid restriction and not just drink extra fluid. It is important for patients to not increase fluid intake on their own. Increasing fluid intake without provider guidance may worsen pulmonary edema. This is the next question. The nurse is caring for a client admitted with left-sided heart failure. Here are the assessment findings. Respiratory rate is 32 breaths per minute. Oxygen saturation is 89% on room air. Patient has crackles throughout the lungs, and blood pressure is 168/90. Which nursing intervention should the nurse perform first? Answer choice A, administer furosemide PO as ordered. B, place the client in high Fowler's position. C, notify the healthcare provider. D, restrict oral fluids. What do you think about this one? The correct answer is B, place the client in high Fowler's position because the client is demonstrating acute pulmonary congestion, which is secondary to worsening left-sided heart failure. The nurse's immediate priority is to improve oxygenation. Placing the client in high Fowler's position will maximize lung expansion and reduce venous return. And you know what? This can be performed immediately without a doctor's order. It's an independent, fast, and safe nursing intervention that addresses the client's breathing and immediate need. Furosemide may be an appropriate treatment for pulmonary edema because it reduces fluid overload. However, the route of administration is important. The medication needs time to work and the client is hypoxic. The provider should certainly be notified, but the nurse should first implement immediate nursing interventions to stabilize the client. Fluid restriction in answer choice D is not correct because it will not improve the client's immediate respiratory distress. This is the next question. Which assessment finding is expected in left-sided heart failure? Answer choice A, ascites. B, liver enlargement. C, pulmonary edema. D, abdominal distension. Which one will you select? The correct answer is C, pulmonary edema. Let's break it down. When the left ventricle fails, blood backs up into the pulmonary circulation, which will lead to pulmonary edema. In a patient with pulmonary edema, you will see signs and symptoms like crackles, difficulty breathing, orthopnea, and pink frothy sputum. Answer choices A and D are not correct. Ascites is a result of systemic venous congestion, and this is connected with right-sided heart failure. Liver enlargement happens because of blood backing up into the systemic circulation. This is another sign of right-sided heart failure. The remaining two questions are for you to answer. Take a look at this one. A client with heart failure has developed worsening crackles despite receiving IV diuretics. Which hypothesis should the nurse prioritize? Answer choice A, activity intolerance. B, imbalanced nutrition. C, anxiety. D, impaired gas exchange. Which of them will you select? Place your answer choice in the comment section. This is the next question. A nurse is preparing to administer digoxin to a client with chronic heart failure. Which assessment finding requires the nurse to withhold the medication and notify the provider? Answer choice A, blood pressure of 128/76. B, apical pulse of 52 beats per minute. C, respiratory rate of 18 breaths per minute. D, oxygen saturation of 95% on room air. What do you think about this one? Which of them will you select? Place your answer choice in the comment section. Thanks for watching and learning from this video. Subscribe to this channel for more NCLEX question breakdowns. If you have any questions, you can place them in the comment section. See you next time.